Tomorrow we'll deliver an additional 600,000 N95 masks to New York City to take care of the needs of the public hospital system. It was a request of Mayor de Blasio. We've been working great with Mayor de Blasio, getting him a lot of stuff. He's working very hard, I can tell you that. And we're working really very hard with New York City and with New York State. And at the request of Congressman Lee Zeldin out in Long Island, we will also be delivering another 200,000 N95 masks to Suffolk County, where they need it very badly. So we're getting that out on an emergency basis. Should be there tomorrow. We'll also be deploying millions of N95 masks to other locations that Admiral Polovchak will detail shortly. The Admiral will be up in just a couple of minutes. Over the last 24 hours, FEMA has delivered an additional 500 ventilators to New Jersey, 500. And again, the governor has been very thankful. We're working very hard with New Jersey, including building hospitals. We've also sent an additional 200 ventilators to Louisiana, definite hotspot, 300 to Michigan, working very well, I think, with the governor. Amazingly, 600 will be going or have gone to Illinois. And, I mean, there's a governor, I hear him complaining all the time. Pritzker, I hear him, he's always complaining, and yet I just said, give me a list of a couple of the things we've done in Illinois. And we're building a 2,500-bed hospital in McCormick Place. That's the big convention center in Chicago. And we're helping to staff it, and probably will end up staffing it because he's not able to do what you're supposed to be able to do as a governor. He has not performed well. And we're also sending 100 ventilators to Massachusetts. So we have 600 to Illinois, we have 100 to Massachusetts, we have 300 to Michigan, we have 200 to Louisiana, we have 500 ventilators, 500 going to New Jersey. And this is being done by FEMA, being delivered by FEMA. And it's some job. Just think of that when you think about 500 ventilators. A ventilator is a big deal. We're also establishing a federal medical station in the Washington, D.C. area to help Washington, D.C., and working very closely with the mayor and everybody in Washington, D.C. At the same time, Governor Inslee, we appreciate this, of Washington State has returned 400 ventilators, which can now be deployed elsewhere in our country. So the state of Washington's done very well. They won't be needing some of the ventilators that have been sent, about 400, that's a lot. And we appreciate that he's able to give them back. He feels confident that they are in good shape for the coming weeks until we can declare a final victory. In the days ahead, America will endure the peak of this terrible pandemic. Our warriors in this life and death battle are the incredible doctors and nurses and healthcare workers on the front line of the fight. We pledge to them our eternal gratitude and everlasting support. They make all of us very proud. Our country is very proud. We have people, they love our country. The world loves our country, most of it, probably all of it. They just don't say it. I can report today that the United States has now tested and gotten results of 1.67 million people. That's far more than any other country has been able to do. And you remember we inherited a broken system, so a lot of this has been developed. By Tuesday, 1,200 brand new rapid point-of-care testing kits has been produced by Abbott Laboratories, great company, and they'll be distributed to all of our public health labs. That's a 15-minute test, even less, as well as the Indian Health Service, the CDC, and the Strategic National Stockpile. So we're going to have 1,200, and on a weekly basis, we're making a lot more. They go very fast. They're very accurate tests. And other countries are wanting them, so at the right time, we'll be able to do that. But right now, we're getting them to all of ours. So we've done 1,670,000 tests. Think of that, 1,670,000 tests. And we have a great system now. We're working with the states in almost all instances, but we have a great system. And the other thing that we've bought a tremendous amount of is the hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably. It's a powerful drug on malaria. And there are signs that it works on this, some very strong signs. And in the meantime, it's been around a long time. It also works very powerfully on lupus. So there are some very strong, powerful signs, and we'll have to see because, again, it's being tested now. This is a new thing that just happened to us, the invisible enemy, we call it. And if you have no signs of heart problems, the azithromycin, which will kill certain things that you don't want living within your body. It's a powerful drug. If you don't have a problem, a heart problem, we would say let your doctor think about it. But as a combination, I think they're going to be, I think there's two things that should be looked at very strongly. Now, we have purchased and we have stockpiled 29 million pills of the hydroxychloroquine, 29 million. A lot of drugstores have them by prescription, and also, and they're not expensive. Also, we're sending them to various labs, our military, we're sending them to the hospitals, we're sending them all over. I just think it's something, you know, the expression, I've used it for certain reasons. What do you have to lose? What do you have to lose? And a lot of people are saying that when, and are taking it, if you're a doctor, a nurse, a first responder, a medical person going into hospitals, they say taking it before the fact is good, but what do you have to lose? They say take it. I'm not looking at it one way or the other, but we want to get out of this. If it does work, it would be a shame if we didn't do it early. But we have some very good signs. So that's hydroxychloroquine and azithromycin. And again, you have to go through your medical people, get the approval. But I've seen things that I sort of like. So what do I know? I'm not a doctor.